Hello, this is Dr. Stanley Lang. Welcome to this broadcast, and the topic is Lyme disease, the need to detox, which means the need to remove toxic substances. Now, the reason I wanted to share about this today was because I had two different adult patients who were actually there in part because of concern for their children, which were also adult children, so they're kind of out of the home already. But they were having problems, the children were, with chronic Lyme disease. And the program that they were using, as the parent described what was being done, I realized this had a very unlikely chance of helping these young adults get better, that they would continue to suffer from their chronic Lyme disease. And the reason for that is because of these so-called toxic substances that the body needs to get rid of. Now, one of the people that I encourage you to look at on YouTube is probably one of the easiest places to do that, is Dr. Dietrich Klinghardt's work. Now, he is featured in a lot of different settings, different subjects, but some of the stuff that he talks about is on Lyme disease. Now, it gets kind of detailed, so it's a lot to wade through sometimes to kind of dig into what he's really presenting. But he's very, very, very knowledgeable about this subject of the need to detoxify the body if you're dealing with chronic Lyme disease. And he's one of the people that I've paid a lot of attention to, who has gained insight into this subject over decades of working with chronic Lyme disease, himself being a former sufferer of Lyme disease, or maybe he still has some symptoms from it, from all I know. But the point is, from his perspective, in which I think he's right, is that the reason we're dealing with chronic Lyme disease is not because the germ has somehow morphed into something that has become a whole lot more vigorously bad, but because our body's immune systems have become unable to deal with this germ. And so it has changed from something that could cohabit our body, so to speak, as do a lot of other bacteria that live in our biome without causing us problems. And it's morphed into something that sometimes causes significant disease and sometimes doesn't. We know that from DNA evidence that Lyme disease, or the Lyme organism, has been present in humans for hundreds of years, and a variance of this germ has been present in humans for thousands of years. So why all of a sudden do we see so much Lyme disease? Are there a lot more infections than there used to be, or is there a change in the human body? Well, we know that ticks are a lot worse, and we know that some people, after they are re-exposed to the Lyme organism through a tick bite or some other arthropod that transmits Lyme disease, we know that that some people do get suddenly very sick. So there is something about acute infections that is definitely real, but there's something else going on also in this concept of chronic Lyme disease, and why it sort of sticks with some people, and what do you do about it? Well, one of the things that Dr. Klinghardt is focused on is the idea of how you have to get rid of the toxins in the body for some people to get better from Lyme disease. And increasingly, it's been my experience that more and more people have to address this issue if they want to get better from their chronic Lyme disease. So that's why I wanted to talk about this. So what does the phrase actually mean, to remove toxic substances? You see, in medical school, we didn't learn about this. It's not taught. In residency, it wasn't taught, and it's still not being taught because it's just kind of assumed the body takes care of itself, even though we know we're living in an increasingly toxic world. We know that the body has mechanisms to get rid of toxins. They get passed through the liver, they get passed through the kidney. But what we also have kind of believed is that toxins that don't get moved out for whatever reason get stored, like in fat cells in particular. Well, there are thinkers like Dr. Klinghardt that believe that these toxins don't just get stored in fat cells. They get stored in cells all around the body, and depending on where that part of the organ where these toxins are being stored, that part of the body is relatively unable to deal with Lyme when it's becoming more aggressive, so to speak. So how do you start to detox? Well, first of all, I would say you have to be committed to stop putting the toxins in the first place. If you're not committed to that, then detoxing is kind of like trying to clean up a dirty pond or something while somebody's pouring wastewater into the pond at the same time. You'll never end up with clean. And so where do the toxins come from? Largely from our food and from what we drink. What are the toxins that we're dealing with? Well, mainly the chemicals that are added to our food supply either before or after for the purpose of preservation, but before being herbicides and pesticides. Increasingly, glyphosate is being sprayed on more and more food, even though it's being implicated as now it's being implicated more than just implicated. It's been identified with huge financial rewards for victims as a cause of cancer. But it causes a lot more disruption to the body than that. We'll just say for right now, for the purposes of this video, that it messes up your immune system in a lot of different ways. And then it makes you more sensitive to all the other toxins. So it like magnifies the effect of other toxins. So how do you stop getting poisoned, so to speak, by this chemical? Well, first of all, you need to stop eating foods that are not organic, because most of them have a lot of glyphosate on them. By a lot, I mean by enough to make you ill. Now, if you measure it in parts per trillion, it may not seem so much, but you don't need much glyphosate to start causing disruption. So you have to limit the foods you're eating. And some people just don't think it's worth it to eat organic. They think that it costs too much. And let me tell you, what's really expensive is disease. Disease is expensive. And so organic food is more expensive than non-organic. There's no question about that. But disease is really expensive. And most people, if they don't change their ways, are going to suffer from the results of this chemical in their body down the road. Now, it may not be a direct result. It may be a lot of indirect effects, but it's going to happen to you if you don't start cleaning up your diet as much as possible. The foods that are particularly sprayed with glyphosate are the GMO foods, genetically modified organisms. And so you need to eliminate those from your diet completely. But the grains, many of them have glyphosate sprayed on them at the time or just before harvest. Surprisingly, one of the grains that has the most glyphosate sprayed on it are oats. So guess what? Your oatmeal probably has glyphosate in it, unless you're eating organic oats. So does most of the wheat have it sprayed on it. So most of the bread and other grain products you're consuming has glyphosate. So you need to move to organic. And so do the restaurants that serve the food to you. And if people start demanding organic, then people will start responding. So that's the first step. You've got to clean up what you're eating, or else the toxic waste dump remains toxic even if you're trying to detox. So what can you do to detox, so to speak, to help the body to get rid of these things? Well, one of the most important things that you can do is to take a supplement that is called fulvic humic acids. And these supplements are little known at this point, but they're easy to use. They come in very concentrated forms. You put a few drops in a glass of water and drink it once a day. And these are very powerful to prevent absorption of glyphosate. And there is some research that shows that fulvic acids can actually pull glyphosate out of the brain. So these are powerful ways to help the body to detox. What else can you do? Make sure that the body has all of the critical nutrients that it needs for the cells to work at their best. If you've got half of the cells functioning at half speed because they're missing key nutrients, then guess what? The detoxification process, this removal of toxins, doesn't happen. The body doesn't have the resources to move the toxins, so it stores it. Wherever it stores it, according to Dr. Klinghardt, these are places where the immune system has a difficult time battling the Lyme organism, which for whatever reason has become more pathogenic in some people. Now, the Lyme organism can morph into a form that is what we call biofilm form. And biofilm, when it forms in the body, it's very difficult for antibiotics to penetrate biofilm. Even the best antibiotic only penetrates biofilm 50% of the time in the laboratory setting, and we don't know what exactly happens in the human body. But if you have biofilm, and there's no way to test, you just might, if you have biofilm form of Lyme, then it's even more critical that you have your immune system engaged to help the body deal with this problem, because the antibiotic by itself isn't going to do the job. Your immune system has to be engaged for you to be successfully getting better. And so one of the ways to help the body being more engaged, as I said, is you got to have all the key nutrients covered, meaning you have to be eating nutrient-rich food, and you probably need to be taking a broad-spectrum nutritional supplement of some sort. Now, there's also a supplement or a herb, depending on what you want to call it, there's some evidence in laboratory research that stevia, the whole leaf stevia, can kill the Lyme organism. I have several patients that are using our particular stevia protocol who have recovered from Lyme disease just taking the stevia at the right dose. So that's a strategy that is completely non-toxic, because when we use antibiotics, that damages your biome, but stevia doesn't damage your biome. It's a particular extract. It can't be the stuff that you normally buy in the store. That has no effect on the Lyme organism. So these are things that you can do to help clean out the body, which is basically arming all of the body's chemical systems for detoxifying with enough nutrients for it to do its job. And using this fulvic humic acid supplement is a critical part of that process. So these are some of the things that you can do right now. I encourage you to be thinking about this as you're dealing. If you have a loved one who's dealing with chronic Lyme disease, these are strategies that are an important part of it. Taking the antibiotic alone, or taking a whole bunch of antibiotics, is only going to make you sicker in the long run, because you're knocking out your biome, which is part of your immune system. So I hope you found this information at least challenging enough to start looking a little bit deeper. We do have a really simple program that can teach you a lot more about these things. If you want, you can access it with the link below this video or on the video, depending on where you're seeing it. Or I encourage you to go see Dr. Klinghardt's stuff that's on YouTube. There's a lot of different information there. His protocol is completely different than the one that we offer. And just follow one of these protocols that involves detoxifying the body, not just trying to kill the germ, because just trying to kill the germ will not work for most people that are dealing with chronic Lyme disease. So I wish you well, God bless, and have a great day.